And we're back to close out the first day of the 2021 Cap to Cap program. Please welcome Dr. Todd Strumwasser, President of the Northern California Division of Common Spirit Health.
Hello and good afternoon. Can everybody hear me? Not if you can hear me. All right, I'll assume you can anyway. My name is Dr. Todd Strumwasser. It's my great pleasure to serve as the president of the Northern California Division of Common Spirit Health, the parent company of Dignity Health. On behalf of Dignity Health, our 6 hospitals serving the Sacramento metro area, our 16,000 healthcare heroes, and the Sacramento Metro Chamber of Commerce, welcome to the 2021 Capital to Capital program and the congressional presentation with Congressman Bera. As this event's sponsor, thank you for the opportunity to say a few words. It goes without saying that the last 19 months have been incredibly challenging for all of us. For the second year, we are unable to participate in this great event in person. Our lives were completely turned upside down, and many of us find ourselves still navigating a sea of uncertainty, dealing with grief and struggling with mental health and disarray around us. Our children, businesses, and our way of life have all suffered immensely. There is still so much work to be done to get us through this pandemic. And as a clinician, I see our only way out of it is to get people vaccinated. With more people getting vaccinated every day and the commitment from our community and leaders like all of you, I see bright days ahead. Even the possibility of holding this event in person next year. If you haven't been vaccinated, I strongly encourage you to do so. In closing, I wish everyone a productive week of meetings and advocacy as we continue to push the Greater Sacramento Region forward. The timing and the conversations that we will be having this week couldn't be more critical. And now it is my honor and privilege to introduce Congressman Ami Bera. Congressman Bera has been a champion for our region, particularly as it relates to issues around healthcare, from fighting to protect the Affordable Care Act to strengthening and protecting Medicare. In fact, just last week, Dr. Bera spearheaded efforts to urge his colleagues to address impending Medicare payment cuts that will have a dramatic impact on providers if Congress doesn't act before January 1. Thank you, Congressman, for leading the charge to protect Medicare. One fun fact about Congressman Bera is that before representing the 7th Congressional District, he practiced as a physician at Dignity Health, where he lived our mission of providing quality services to the most vulnerable. Ladies and gentlemen, please give a warm welcome to Congressman Ami Bera.
Todd, thanks for that generous introduction. There was a day back maybe 25 years ago that as a practicing physician at Med Clinic, which is now Mercy Medical Group, and was medical director of care management for the 5 Dignity hospitals. Also used to admit patients to Sutter, and I know Sutter's a major sponsor. And then in a prior life was Dean of Admissions at UC Davis Medical School. So we've got 3 of the 4 health systems covered. And then my wife, Dr. Janine Bera, comes out of the Kaiser system and now is at WellSpace Health. So we've got healthcare covered in the Bera household here, and obviously know how important it is. I thought I would, I've had a chance to interact with a number of the working groups today, and so there may be some redundancy in my comments. My apologies. But I thought I would take a few minutes, 5 or 10 minutes, just to kind of frame where we are, both as a region, but also as a country, what's happening here in Washington, D.C. I'm pretty close to the Biden administration and Team Biden, and can give you kind of an up-to-date view of what's happening here and what might happen this week. And then just reflect back, and maybe I'll start with that reflection back. Todd, as you pointed out, we've gone through a challenging period of time, both regionally, but as a nation and as a planet with the global pandemic with COVID-19. It certainly has exposed some fissures in American politics and American life. none of us ever would have expected face coverings or vaccinations to be a political thing, but those divisions are there, and I think we have to acknowledge where we're at and try to address that. But it also has exposed a lot of communities coming together, our region coming together to try to get through the pandemic. And if you look at the last 20 years, it's easy to say, well, our politics are broken and the country's ungovernable right now. In truth, we came together very early in the pandemic to pass not just one major bill, the CARES Act, but two major bills as Democrats and Republicans that were thrown together fairly quickly, that were large, that helped sustain hospitals, providers, businesses, and families through the initial phase of the pandemic when we really weren't sure what was this going to look like? Was there just going to be that first phase back in spring of 2020, but then we went through the summer of 2020, and then we went through the fall and winter of 2020, and now we're going through the Delta variant. It'd be easy to say our politics are broken, but we did come together to put those two very significant pieces of legislation together. It'd be easy to say, well, look at the presidential election, how divisive it was, how divided the country was. But I look at the presidential election, the election that took place last November, about a year ago, as a remarkable exercise of American democracy. As divisive as it was, you had record numbers of people coming out to vote, record numbers of communities of color, of young people coming out to vote. You saw the election being contested in courts. You saw unsung heroes, the folks that actually count the votes, as it was a very close presidential election as they were counting the ballots. You saw audits. Ultimately, the election was certified by 50 states, sent to the House of Representatives and to Congress. You saw the events of January 6th. Again, that's a day that we should recognize what happened on that day. But you also saw Democrats and Republicans, House members and senators come back in session and finish our job that evening, certify that election, and you saw a transition of power. I frame that because it's always easy for us to look at the negative in this country. Our democracy survived, our country's resilient, but now let's start looking forward to where we are coming out of the pandemic. So working with the Biden administration, and we've worked pretty closely, I would say if you think about President Biden's agenda, think about it in the context of not 3 bills, but 4 bills. The first bill being the American Rescue Plan that we passed in March. That bill was all about getting past this pandemic in terms of getting shots in arms. And as Todd said, the best way for us to get out of this pandemic is to get the country as fully vaccinated as possible. You started to see a little bit of a reopening there. It was also about getting resources to cities, counties, and states to backfill, and businesses to backfill the impact that the pandemic had. And that was the core of the American Rescue Plan, to set the foundation for recovery. You're seeing those dollars that counties and cities in our region have received start to get allocated to places, including the school districts that got tens of millions of dollars as well. Hugely important. And my message to the folks that are participating here is a lot of these are one-time funds. We're probably not going to get an opportunity like that anytime in the near future. Address the issues and impacts to the communities that all of you serve right now, but also think strategically of how we can leverage those funds to also kickstart our communities as we come out of the pandemic. So that was bill number 1. Bill number 2 was the bipartisan infrastructure bill, which passed out of the Senate with a large bipartisan vote. It's over in the House. Had you asked me, I would have said, when we got back in September, we'd pass that one fairly quickly. That would have been my desire, and send that to the president's desk. That bill is a hugely important bill as well. It's a hard infrastructure bill it's a $1.2 trillion bill, which has $550 billion of new resources in it. Incredibly important for us in the region. I was just on the transportation task force. We're ready to build out that EV charging station infrastructure. We have great support from RT and rail and transit. SACOG's done a wonderful job kind of laying out the framework of how, if we can pass that bill, and there's a lot of money in there for rail, transit, EV infrastructure, along with roads, bridges, highways. I think we're ready to go after those grants and bring those dollars to the region. So our job is to get that bill to the president's desk. Not controversial, broad support across the Democratic caucus. The politics of the third bill, which is the Build Back Better Act, are holding it back a little bit. But I was at the White House last week, with a group of pragmatic, or what the media calls us moderate Democrats, meeting with the president. And I think we're 90 to 95% of the way there. I think there's some hangups on how you pay for it, and we want it to be paid for, and where those revenue streams come from. But I think we're getting pretty close. And my hope would be that as of this week, there will be an agreement on the framework, if not an actual bill for us to vote on. And if we have that agreement, that we can actually vote on the infrastructure bill this week and get that sent to the president. He's indicated he wants that before he goes to the COP26, the climate change summit in Glasgow. And I think we ought to give it to him, so he's got things that he can actually point to when we're talking about climate change and trying to get the rest of the world to do things. We've got to do our own here at home. And I think it strengthens his hand in that negotiation. So cautiously optimistic. It's Congress. We know how to screw things up. So, until you actually have that vote, nothing's finalized. That third bill, the Build Back Better Act, is hugely important. And here's why it's such an important bill. It's the human infrastructure side. It's the jobs and workforce side of things. And I think the media characterizes it as a safety net expansion. I characterize it as making investments so that you can have full participation in the workforce. And what I mean by that is, when you invest in childcare, as we've seen through the pandemic, you allow folks that have universal childcare, but you allow full participation in the workforce. And why that's so important is it disproportionately impacts the female full participation in the workforce. When you provide in-home care for family members and others, disproportionately women have to come out of the workforce to care for an ailing family member. We want that full participation, and we actually need that full participation because women, for at least the last 2 decades, if not longer, have been a bigger part of who's graduating out of college, who's graduating out of graduate school, et cetera. So if we can make that workforce participation more reflective of the broad professional workforce that we have, that bill makes investments in vocational and technical training. It's great if we pass this infrastructure bill. We don't have the construction workers. We don't have the plumbers, the pipe fitters, the technical skills to do all of that work. Those are good paying jobs. We ought to make those investments. And again, I think we're poised here in the region to do that fairly well. So that's the third bill. I talked about a fourth bill, which doesn't get much coverage, but is hugely important, the American Investment and Competitive Act. It's passed out of the Senate, passed out with a strong bipartisan vote. And that bill, people often talk about as a China bill. It's not a China bill because it's an American bill. It's about investing in what we do best, R&D, investing in supply chain resiliency, bringing semiconductors back. And why semiconductors are important to the Sacramento region is, if you look at Folsom, you've got both Micron and Intel up there. We want to bring those dollars to the region and really have this ecosystem where we're doing the R&D and design around the semiconductor industry. I put all that together because I'm wildly optimistic about what the future of the Sacramento region looks like. We've gone through a challenging time, but we've also laid the groundwork to really accelerate into the 21st century. And what I mean by that is, teleworking, telecommuting is not going away. Our proximity to Silicon Valley, our proximity to the Bay Area, you're seeing a lot of those workers having migrated up to the Sacramento region, living in the Sacramento region. If we can build an infrastructure that ties Sacramento to the Bay Area and Silicon Valley, I think we're in a great place to experience phenomenal job growth. We've got a great university system going from our community colleges to Sac State to UC Davis. Aggie Square is going to be poised to be a great economic driver of our region and innovation driver. When you think about the mobility center, it'll help us, again, be a leader in that area. Not to say, when we think about the surrounding area, we're still the breadbasket, not just for the United States, but also for a big part of the world. We're going to have to figure out how to better manage water in the droughts, but also we've just seen, what they call it, a bomb cyclone over the weekend. So, we've seen how we've got to manage that. So there's a lot happening. I'm excited. I hope all of you are excited. I hope we're starting to put the pandemic in the rearview mirror. And as we go into 2022, that we just come out of this quickly, fast, and prosperously. So I'll stop with that. I'm happy to take a couple questions, but again, we're going to get these last two bills passed. We'll get the innovation competitiveness bill passed as well, hopefully before the end of the year. And I think that is a generational investment in the United States, but also in our region.
Excellent, excellent. Thank you so much, Congressman. This is Brandon Black, Director of Public Policy with the Metro Chamber, and we have been gathering some questions for you in the chat from our attendees. We'll just get straight into it. COVID-19 pandemic has brought to light the importance of mental health and wellness, not just in our workforce, but in all communities. At the national level, have you experienced a newfound commitment to addressing the overall health of Americans?
I think we have. I think we've seen the challenge that the pandemic and the stress that it's put on older Americans because of isolation, but also on the youngest Americans, because of the stress and pressure of trying to learn from home, et cetera. So there's a very different conversation taking place around mental health and acknowledging mental health. In addition, and I talked about this with the healthcare task force, when we go back and look at the importance of telemedicine, telehealth, the one area where I think we're going to have the biggest impact was on mental health. And I think when we do that research, when we look at outcomes, and you talk to a lot of providers, it's the mental health aspect. It's removing the stigma. You've seen compliance. So the mental health of America is hugely important, not just directly, but how do you think about mental health in a community context as well? So, I do think the stresses of the pandemic, the challenges that we saw with the George Floyd murder, the activism that we saw last summer, but then, also kind of going into January 6th, there's a very different conversation about mental health.
Absolutely. Thank you for taking that. Appreciate it. Another top of line discussion with many employers at this point is the labor shortage, be it a lack of workforce or workforce leaving the region for various reasons. In the Greater Sacramento region specifically, the business community is actively working to reverse workforce retention trends, but could always benefit from hearing the best practices of regions addressing similar shortages. Are there any national discussions taking place that would be beneficial to reversing this trend in our region? Yeah,
so academics are starting to take a look at this and thinking about, okay, what has happened in the workforce? Because obviously we see the number of job openings that are out there. Some of it is something, a little bit of what I addressed in the Build Back Better Act is providing those resources, childcare, in-home care, et cetera, will allow full participation in the workforce, particularly with female heads of household. And I think that's hugely important. I also think that, we talked about this on the healthcare that there are going to be a number of folks that, were within a couple of years of retirement who may never come back into the workforce. I worry about that most acutely with our healthcare workforce, nurses and doctors, that they may stick it out through the pandemic, but many of them who are at the top of their profession right now may leave the profession. I think we've got to think through that. One, how can we keep them engaged and working, because we can't lose that talent and skill. So that is something that we're certainly thinking about. The changing nature of work. I mean, the pandemic has probably changed the type of jobs people want to do, quality of life issues, et cetera. So I think we ought to understand what that looks like as well, and how we address that going forward. But I think our approach at this juncture is a lot of that's built into the Build Back Better Act.
Excellent. And sort of in the same vein to the question that we had asked a little bit earlier about mental health, the homelessness crisis obviously is an issue that is certainly at the top of the issues that we face back here at home. There have been advances certainly in designing sustainable solutions for the region, but of course these solutions take time. What are your thoughts on additional short-term solutions that our region could implement to advance our response to the growing issue here in Sacramento?
Yeah, so this is one that I've talked to the mayor about. I've talked to the county executive about a little bit, and obviously, as we're starting to open up again, we've got to address the homeless challenge, particularly most acutely in downtown, midtown, along K Street, but also you see it in the suburbs and you see it in the surrounding counties. I mean, one idea that we've floated is, if we start to move folks into shelter, I'm not a big fan of campgrounds, because I do worry that some of those campgrounds become more permanent. But if you have vacant big box stores, et cetera, can you get folks off the street into shelter? I think that's a better way to go, because when you have things like the bomb cyclone, you're putting folks in a safer spot. Or when you have the 110-degree days in Sacramento, you have the ability. But that's a short-term solution. That's getting folks off the street. You've got to provide the wraparound solutions as well. So social workers, if it's a substance abuse or mental health issue, that can go in and do the case management and figure out what happened that led that person to being on the street. I would guess that a large number of folks were probably the economic downturn. They were one or two paychecks away from having to live in their car. Can we get those folks retrained and back into employment and in a job? But there's also, there's going to be the longer term, more chronically homeless populations that you'll have to address the mental health or substance use issues. And that'll take, again, a longer term investment in the wraparound services. But if we don't address those underlying root cause issues, we're not actually solving the challenge. And I think if we could get folks into shelter and provide those wraparound services, you're taking folks off the street. I think it's a more humane solution than the campground challenge. And then you could drive intensive services there. I also think longer term, again, my intuition, and this is not based on objective data, is something changed in the last 5 or 10 years in terms of the rapidity and makeup of the homeless population. There's some emerging literature, based on the drug challenges that we have around meth and fentanyl and so forth. We ought to understand that. We talked about it a little bit on the public safety task force. And I think we should, understand the nature of the homeless here in our region, so we can better understand how to address and lift those folks out of homelessness.
Got it. Understood. We've got another question in here. There's been a lot of discussion about the forthcoming OSHA vaccine and test requirements for large employers that the president had announced a couple of weeks ago. There are certainly those who note that these steps are needed to give employees confidence to return to work. What advice would you have for businesses as they start navigating these new requirements?
So obviously, some of the vaccine mandates are hugely important at keeping workers safe and as they're coming back. But also, we don't want to go through a shutdown again. We also, we're seeing the Delta variant wane. We're paying close attention to a variant that potentially is emerging in the United Kingdom. Hopefully, we're seeing their cases go up. Hopefully, it's not a variant that is not as responsive to our vaccines. Thus far, we've been pretty lucky. I would say, work closely with OSHA, work closely as you try to figure out the best way to implement some of these vaccine mandates and the like. But I would, our office is here to be, as supportive as possible to help you navigate some of those rules if we can. Obviously approach us with questions that you might have and guidance, and we can then try to get you answers for those. I could probably take one last question, and then I actually have to head up to the Hill.
Understood. Given the administration's emphasis on social and racial equity, including things like Justice 40, what should we be doing locally to incorporate equity into our infrastructure and transportation projects specifically?
Yeah, I think that's a great question. When we talk about workforce inclusion, we're talking about equitable workforce inclusion. And what the pandemic exposed was that there were a lot of vulnerable parts of the Sacramento region and vulnerable communities that didn't have good broadband access, that didn't have, so if their kids had to go to school virtually, or if you had to work virtually, if you didn't have those resources, it was going to be really difficult. And unfortunately, many of those kids were left behind. When we talk about broadband as a big part of infrastructure, what we're really talking about is how do we make sure that infrastructure exists in these communities that are under-resourced, both rural communities and under-resourced urban communities. As we get those grant dollars, we should be very strategic about how we build out that infrastructure. Again, on the transportation workforce, we talked about how we put EV charging stations intentionally in some of these communities, because if we're going to go towards fully non-fossil fuel run cars, well, you're going to need that infrastructure in every community if you're going to ask people to move in that direction. So I think we can be very intentional in how we think about it. I think we are being very intentional in thinking about it through great organizations like Valley Vision, SACOG, and others. And again, with the resources that hopefully we get to the region, let's try to build that equitable infrastructure for the foreseeable future.
Absolutely. Thank you so much, Congressman, for your time. Super appreciate it. We'll return the floor back to you for any closing comments you may want to make to the group.
No, other than I would just come back to, I'm wildly optimistic about our region's future. I think we should be very intentional. We should, cap to cap is great because it brings together folks from around the region. SACOG and Valley Vision are great because it brings folks together around the region. And I do think we're starting to think of our future in a much more regionally interconnected way. So that is a good thing. And again, we're here to help. Let's get these bills passed. But that's not the end of my job. That's the beginning of my job, because now it's about getting those dollars and resources to the region. So again, thank you for giving me a few moments.